Hello dear friends, this is Dr. Sejal Naik, Director of Belly and Love Women's Care, Surat. Today I am going to demonstrate the submucous myomectomy type 2. This is the 28 years old infertile patient with a huge polyp coming out through the internal os inside the intracervical canal. On hysteroscopy, we couldn't find out any fibroid on primary inspection. Then we reduced the intrauterine pressure to see any bulge coming through it. The myoma bulge inside the cavity on reducing the pressure and disappear on increasing the intrauterine pressure. So that was the pre-surgical ultrasound. We notified the exact location and the site of the fibroid and its compression inside the intrauterine cavity. So pre-operative ultrasound is important. We did laparoscopy to see if the bulge is more on the serosal side so that we can remove from the laparoscopy, which was not there. So we put the primary incision on the bulge which was disappearing at that side, and then we remove the endothelial and the superficial myoma tissue with the resectoscope. Now once we put the incision, you can clearly differentiate the normal myometrial endometrial junction and the fibroid white shiny tissue. After few cuts, we let the myometrium to contract by reducing the intrauterine pressure that will push the fibroid inside the cavity more. We can use the cold loop to lift the myoma from its base. On small serial cutting, you can find out the very clear margin and the pseudo capsule between the fibroid and the normal uterine musculature. So all the time this is the glycine we use with a monopolar resectoscope, and we try to dig it like this is the cold knife technique, where you can see the pinkish very clearly shining pseudo capsule of this submucous fibroid. On piecemeal we remove these tissues on repeated resectoscopic movement and intermittently cold loop technique to lift the fibroid from its capsule. That reduces the use of the cautery and that reduces the chances of perforation and the damage to the healthy myometrium. This kind of type 2 myoma of small size should only be attempted by the experts to reduce the injury and the complications. As you can see, we literally had to dig to remove the entire myoma. Hemostasis here is equally important. We can cauterize the bleeder with the ball electrode and remove all the specimen at the end of the procedure. Thank you so much.